Hi, this is Medina Regalia, and this is my Zoom for the surgery class talking about rodent and rabbit anesthesia and some signs of pain that you might see in them. Um, I have personal clinical experience with a lot of exotics, and so I was pretty excited to do this topic. Not a whole lot of I've owned rats and mice, but in clinic, I did a lot of work with rabbits, and they all generally kind of have the same type of behavior when they are experiencing pain, but most of the time they hide it really well. Rodents and rabbits are all prey animals, so they do their very best to not appear as if they're suffering. Otherwise, they could be potentially eaten by another predator that's out there. So in clinic, I had worked with wildlife rabbits. So they would come in and we had a scale of how we could determine if they were in pain. Um, so usually we would just look, is there decreased activity? Sometimes it's kind of hard to tell because they are a little bit of a nervous creature. Decreased activity, what does their hair coat look like? Um, are they vocalizing when you're handling them? Teeth grinding is a huge one that we would notice in the rabbits. The rodents, if you would get those in, they would have the porphyrin staining around their eyes, and sometimes if there was other ones in the nest, they would start to attack the ones that were somehow sickened or um, not doing well, but outwardly you couldn't really tell because, like I said, they are prey animals. Some other signs that you might see, they might start licking a painful area, twitching. If you would go down their back, you could kind of detect if they had a bit of a quiver to them. And aggressive rabbits, usually there's something wrong, especially we would get a lot of our patients were typically when people are mowing their grass, they would kind of go over them. So there was a lot of paw injuries, things like that we would see. Um, so there are some medications for it. But before I get to the medications, there was actually a study done that I thought was incredibly interesting. This was done by the National Center for Replacement, Refinement, and Reduction of Animals in Research. And they actually did grimace scales for rats, rabbits, and mice. So what they basically assessed for was orbital tightening. Um, so how squinched up are their eyes, essentially. Um, their nose, were they flattening it? Sometimes you'll notice in rats and rodents that their noses just kind of, they seem more downward facing. I think I can share these pictures with you via Zoom, so I'll share those. Also ears, ear positioning, like are they more forward? Usually when they're laying down a little further, they're in pain. And also whisker changes. So they did look for barbering, things like that for these animals, or positioning of the whiskers. Let me see if I can actually share my screen with you to show what this looks like. While I'm trying to get that up, there are some medications that we can give and prescribe for these animals. We would give propofol if we had to sedate. Isoflurane was a good one. Um, your rats, you could give morphine. It seems like mice, you can give a few more things. They can have several non-opioid analgesics, aspirin, carprofen, meloxicam. They can also have the opioids. Of course, all dose dependent on their size. Rabbits were the ones that we didn't have a whole lot of options for them. We typically gave them buprenorphine, and meloxicam if they were experiencing any kind of pain, at least at our clinic. Those seem to be working the best. And I think I finally figured out how to share. So this one here is the mouse grimace scale, which I thought was pretty interesting. If anybody had wanted access to these printouts, they're in poster form. I printed them out small for myself for my own students. You can order these things from this company, but let me put the rabbit one. The mouse and the rat one are pretty similar, so I'll just not take up too much of your time here, but I will go ahead and share the rabbit one. And then, like I said, if anybody is interested in having a copy of these photos, I'm not sure why it's not popping up. I have to excuse my technological snafu here. Let me pull this. There it is. Apparently when you share, it has to be on the top. There we go. And here's the rabbit grimace scale. As you can see, they just kind of just do it by action units. So if it is not present, is a 0, moderately present would be a 1, and obviously present, it would be a 2. So they are not like our dogs and cats where they're having this larger, longer scale. But it's pretty interesting to see. So here's this one. They're also looking for whisker shape, the position of it, have they been barbered. The nostril shape on the rabbits was, to me, very interesting. I never really thought to look at the nostril shape. So they're going, is it more of a V or is it more of a Y? So that was something that, if you do get a rabbit in, that's if it's not an obvious sign like those ears, like the bottom one is obvious, he's in a lot of pain, or the eyes are completely closed, you can start looking at the nasal passages and things like that. So I personally just thought this one was a very interesting study that they did. I think I have the year. I did not put the year down. But yeah, I will share this with anybody that is interested in them. I don't know if I can add it to the bottom of this post, but I can maybe do that for you guys, or you can just contact me and I will send them to you. All right, so that is my presentation on rats and rabbits, and you all have a good day.